All right, so I have a really great story that I got permission to tell to you guys. But this is the reason why I feel like AI and Dr. Google will never replace flesh and blood doctors. And this is hilarious. So this patient of mine, she always wears heels, right? I don't think, other than outside of seeing her at like exercising, have I ever seen this woman not with heels on. And so one day she's just turned 39, but physically active, trying to take care of herself. She goes to put on one of her heels and her knee gives out from up under her. And I know you've had that experience before. I've heard of people that have done that. They're just walking and all of a sudden knee gives out. And so she's freaking out. She looks online to see what's wrong, what could be going on. And basically the internet tells her that she's dying and she needs to go to the hospital. But then she remembers that she has me. And so she reaches out to me and she goes, oh my God, my knee went out from up under me. I don't know what to do, but like, I'm in terrible pain. What do I do? And I was like, don't wear your heels today. Sacrilege. How dare I say that? But I was like, what you need to do, like, your knee gave out. It's because you're old. We're also friends. So I was like, you're old. It's a thing that happens. But I told her, don't wear your heels today. Wear some gym shoes. Ice your knee. Take an ibuprofen, and you'll be fine by later in the day. And at first, she's like, oh my God, no, I'm dying. I need to go to the hospital. Something terrible is going on. And I'm like, no. This is why you called me. This is what I do. Rest the knee, and you'll be fine. Well, later that day, I completely forgot that this happened. Later that day, we were out at an event together, and I was being introduced to a new potential patient. And she starts telling that story about how just earlier that morning, she was very concerned that, she was going to die and she needed to go to the hospital over this knee that, was hurting her. And Dr. Google told her that it was a septic joint or something. I don't even know what she found. But she's like, but I actually am better. That is the point of having an actual doctor, is that the internet, although it is very good, and especially with all the AI, it's getting very intuitive. It's not the same as being able to look at a patient, look at a situation and say, this is the most likely scenario versus these are all of the things. We are taught how to use differential diagnoses to figure out what are all of the things that could possibly be going wrong. And then based on the story, what is actually the thing that's going on? She twisted her knee. No big deal. Rested it for a couple of hours and she was right as rain, back into her heels the very next day. But that is why having a healthcare provider that gets to know you and looks at you as a person and not a number on a file is the most beneficial thing that you can ever invest in.